Fractures happen fast. Sports, a fall, a weird twist, and in the moment, it's easy to panic. So I use a simple doctor's checklist to keep things calm, safe, and smart. Checklist item 1. Stop and scan. Is it life-threatening? Heavy bleeding you can't control. A bone sticking out, loss of feeling, the limb looks blue, or the person feels faint. That's an emergency. Call right now. Item 2. Don't force it. I don't straighten bones, I don't pop anything back, and I don't test range of motion. Pain is data. Respect it. Item 3. Stabilize. If it's safe to move, I immobilize above and below the suspected fracture. That's where splints shine. Let's clear up the gear. Splints versus braces. A splint is a temporary immobilizer, rigid or semi-rigid support that restricts motion and protects the area right after injury or after a cast is removed. Aluminum foam splint, vacuum splint, SAM splint, or even a folded magazine in a pinch. A brace is a reusable support designed for longer wear. Hinged knee brace, wrist brace, ankle stabilizer. They control motion in a targeted way during healing or return to activity. When I suspect a fracture, splint first, brace later. After imaging and a clinician's plan. Quick splinting basics. Check. Can they feel and wiggle fingers or toes? Check. Is skin warm and pink? Pad. Soft wrap to fill gaps. Avoid pressure on bony spots. Place. Support joints above and below the injury. Secure. Snug, not tight. I leave fingertips or toes visible to watch color and swelling. Recheck. Numbness, tingling, increasing pain, or color change. Loosen slightly and seek care. Braces 101. Wrist and thumb braces. Great for stable fractures or sprains after the acute phase. Limit bending and gripping strain. Ankle stirrups and lace-ups. Control inversion, eversion, used after sprains and some fibula fractures as guided by a pro. Hinged knee braces. Let me bend safely while stopping side-to-side wobble. TLSO back braces. Post-surgery or compression fractures. These are prescription level. I don't self-prescribe. Pain and swelling? I follow RICE in the first 48 hours. Rest. ICE 15-20 minutes on-off. Compression that's comfortable, elevation above heart level. Then I graduate to movement only when cleared. How do I tell a sprain from a fracture? Swelling and bruising happen in both. Red flags for fracture. A pop with immediate dysfunction, visible deformity, pinpoint bone tenderness, or inability to bear weight for more than a few steps. But the truth, X-ray beats guessing. Timing matters. Kids' fractures can heal fast. Adults take longer. Braces and splints are only part of the plan. Bones need alignment and progressive loading. That means follow-up, maybe a cast, maybe surgery, and definitely rehab. Fit check. Good splint or brace fit means pain decreases. Movement is limited the way it should be. Skin stays normal color and temperature, and sensation stays intact. Bad fit looks like pins and needles,